How are co-occurring conditions diagnosed with bipolar disorder? Have you ever wondered how mental health professionals identify conditions that occur alongside bipolar disorder? This process is known as diagnosing comorbidities. Co-occurring conditions are diagnosed through a careful, multi-step clinical evaluation by a licensed mental health professional. The goal is to distinguish symptoms caused by bipolar disorder from those caused by other psychiatric or medical disorders, which often share similar features. The diagnostic journey typically starts with a comprehensive clinical interview. This interview follows established criteria, such as those outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision. During this interview, the clinician gathers a detailed history of mood episodes, including mania, hypomania, and depression. They will also look at symptom patterns, timing, and severity of these symptoms. Because symptoms of bipolar disorder can overlap with other disorders, like anxiety or substance use disorder, the clinician must carefully evaluate which symptoms belong to which disorder. This is crucial for accurate diagnosis. The process can take time, often requiring multiple appointments. Each session may last 90 minutes or more, allowing the clinician to review the patient's history, previous medical records, and how symptoms have evolved over time. To enhance diagnostic accuracy, semi-structured diagnostic interviews and standardized screening tools may be utilized. Tools like the Structured Clinical Interview, 4DSM, or the Composite International Diagnostic Interview-Based Screening Scale help in gathering comprehensive information but are not standalone diagnostic tools. In addition to evaluating psychiatric conditions, clinicians also consider medical issues that may mimic or coexist with bipolar disorder. This helps avoid misdiagnosis. While laboratory tests or imaging are not required to diagnose bipolar disorder itself, they may be used to rule out other causes of symptoms. Accurate identification of co-occurring disorders is essential because they can influence the presentation and course of bipolar disorder. For example, having bipolar disorder along with obsessive-compulsive disorder may lead to a more severe course and greater impairment. Similarly, co-occurring substance use disorders can complicate both diagnosis and treatment. In summary, diagnosing co-occurring conditions with bipolar disorder involves a thorough clinical evaluation by a licensed mental health professional. It requires the use of established criteria to differentiate bipolar disorder from other psychiatric diagnoses. Careful differentiation of overlapping symptoms is achieved through detailed patient history and clinical interviews. Medical conditions that may mimic psychiatric symptoms are also considered. This detailed and cautious approach ensures that each disorder is correctly identified and treated with evidence-based interventions, ultimately improving patient outcomes. Always remember to consult healthcare professionals for personalized medical advice.